at HIM 17 talking to Novant Health Senior Director of Revenue Cycle Services, April York. April, thanks for talking with us today. You know, you were saying your organization is making a notable shift in their culture from what you'd call a patient experience towards a human experience. So what does that mean exactly, and more importantly, what does it mean for your organization?
So I can speak to it from a revenue cycle services perspective. That human experience really takes on a new connotation. When you talk about a patient, a lot of times you're speaking of a number or an individual who's coming into your organization. When you change that more to define it as a human experience, it takes on a very unique element and a different approach. So we're looking at revenue cycle services to be very much a new revenue cycle revolution is what we're defining it. Our operational processes have a tendency to focus on a patient who does not pay their services, does not pay for what we provide for them, and we design those processes around the patient who ultimately ends up in bad debt. So what if we took a unique look at the patient that does want to pay, and we focus on the majority of the patients who do want to pay their obligation and take care of what we've delivered for them. And we designed our processes and our workflows and offerings from a revenue cycle perspective around that individual. And then we also took into account not just that clinical experience, but we looked at what are the controllable suffering elements of a patient's experience that we can alleviate. A patient diagnosed with cancer, I can't control what their human physical suffering is going to be, but there are aspects of their experience that I would define as controllable, and I can remove those elements from their concern or work to minimize those as best I can. So as an organization, we're really trying to hone in on and redefine what that human experience is and develop what we are calling a revenue cycle revolution.
Now, let's kind of drill down into some of those controllable suffering elements that you feel can be eliminated. What are some of those elements?
So, you know, the patient questioning what their out-of-pocket cost is, ensuring that not only are we educating them from very early on in the process, but how can we provide them with multiple options or multiple avenues to satisfy that financial obligation. Many times a patient's definition of the cost of healthcare is really defined by their means or method of payment and the ability and the avenues in which we give them to pay. So if I give them, you know, one single option or a cash check or charge, that really narrows that scope or their ability to pay. But if I give them 7 different options and multiple time frames, it becomes much more affordable for them.
You know, I think a lot of patients will talk about wanting to feel, you know, empathy from their provider, you know, that they really care about what I'm going through and they look at me as a human being. It sounds to me like your organization is taking the philosophy that that feeling needs to be pervasive throughout the revenue cycle as well. It's not just the providers that the patient should feel cares about them, it's everyone from top to bottom.
Absolutely. I don't think anyone presents themselves at the organization. I mean, the definition of a consumer is very different from a healthcare perspective. So yes, they are consumers, but they are not, it's not a choice to consume this particular healthcare experience in many cases. And so as a result, you know, we've got to find ways that we can help them navigate this space, and that we can be compassionate about everything they're not coming in with the intention to not pay for the services that they're being provided. It's just, how do I handle and manage this unexpected cost that I now have presented to me?
If you were going to narrow down, you know, a couple of the most important boiling points for where revenue cycles need to do better in dealing with the patient, what would they be?
It really is that proactive frontline education as far in advance as possible. And it's not just about what their out-of-pocket cost is, it's how their insurance plan works. We've got to do better. If payers aren't going to step into that arena or aren't going to be able to bridge that gap, as healthcare providers, we've got to be able to proactively have that conversation with those patients to say, you know, not just about this individual encounter, you know, this is what it's going to cost you, but in addition to that, here's what you can expect for the future and how your plan's going to kind of play out.
Okay. April, thank you so much for your time and for speaking with us today. You're watching HIM 17 TV.